To develop productive conflict management skills, it is important to learn about 5 different styles of responding to conflict and the uses and misuses of each. It is also important to develop self-awareness of how you respond to conflict under normal circumstances and when you're under stress. You might choose to take a self-assessment such as Style Matters Inventory, which we will introduce in the next segment, though there are also many other ones available. In the next few slides, we'll go over each of the 5 conflict styles as it relates to relationship versus agenda and a description of each style. Directing, cooperating, compromising, avoiding, and harmonizing. Most people have a clear preference for 1 or 2 styles. This style feels natural since we learn conflict patterns early on and continue to favor them as adults. However, knowledge of multiple styles to respond to conflict will open choices for you that you couldn't see before. With awareness of your conflict response style, you can make more conscious choices in responding to others. By understanding and respecting the unique value of each style, you will recognize conflict response styles of others and understand what they're doing. You can depersonalize conflicts when their other person's style is different than yours and deal more constructively with them, take situational variables into account, and take steps to bring out the best in yourself and others. If you have ever taken the Style Matters Inventory, you should pay particular attention to the description and explanation of your style as determined by your self-assessment scores. Additionally, some people experience a change in response style as conflict heats up or stress rises, resulting in what's referred to as a storm shift, or the extent to which one response changes when frustration builds. Pay attention to storm shift signs such as increased heart rate, increased body temperature, or a churning stomach. This shift can be quite sudden and thus surprise, shock, or hurt others. For those who score high in directing, it's important to know that it's most useful when an emergency looms, when there's no time to give or take in a discussion, when you're sure you're right and being right matters more than preserving relationships, and when principles are at stake and must not be compromised regardless of the cost. Directing is least useful when cooperating has not been attempted, when support and cooperation of others who want to be treated as equals is important, when it's used routinely for most issues and others become passive, or when self-respect of others is diminished needlessly. Strategies to implement directing response to conflict include persuade, insist, demand and repeat, compete, control, refuse to negotiate, or attack. As a leader, discourage, challenge, cite policy, set limits and consequences, and instruct. For those who score high in cooperating, it's important to know that it's most useful when issues in relationships are both significant, when long-term ability to work together is important, when a creative outcome is important, when time and energy are available for discussion, and when reasonable hope exists to meet all concerns. Cooperating is least useful when time is short, when the issues are trivial, when you're overloaded with processing, or when goals of other persons are wrong beyond doubt. Strategies include assert self and invite other views, welcome differences, reflect jointly on strengths and weaknesses of all views, and cooperate in seeking and evaluating additional information. For those who score high in compromising, it's important to know that it's most useful when getting a quick settlement matters more than exploring all possible options, when working together is important but time or resources to cooperate fully are limited, when settling on some solution, even if less than ideal, is better than a complete stalemate, and when efforts to cooperate will be misunderstood as directing. Compromising is least useful when in-depth analysis or finding the most creative solution possible is essential, when you can't live with the consequences of getting less than what you want or need, or when deep principles of values are at stake. Strategies include urge moderation, bargain, split the difference, find a little something for everyone, meet them halfway, or give a little and take a little. For those who score high in avoiding, it's important to note that it's most useful when the issues are trivial, when the relationship is insignificant, when time to talk is limited, and when a decision can be delayed for now. When you have little power to openly resist an opponent, but you don't want to actively go along with their wishes. Avoiding is least useful when you care about both the issues involved and the relationship. When it's used habitually for most issues, leading to explosions or freeze-outs. When a residue of negative feelings is likely to linger, when others would benefit from constructive confrontation, or when your role or duties oblige you to take a stand. Strategies include withdrawal, delay or avoid a response, divert attention, suppress emotions, be inaccessible or inscrutable. For those who score high in harmonizing, it's important to know that it's most useful when keeping others happy is the most important goal. When expressing your wishes may bring retaliation from others and you have no means to protect yourself. When you really don't care about the issue, or when you're powerless and have no wish to block the other person. Harmonizing is least useful when you're likely to harbor resentment, when it's used habitually in order to win acceptance by others, and when others wish to cooperate and feel like directors if you harmonize. Strategies include agree, support, acknowledge error, give in, convince self it's no big deal, placate, smile, and say yes, grin and bear it. You will watch another brief interaction between healthcare professionals. As you watch this, keep in mind of the conflict response style mentioned earlier and see if you can identify the style used by each of the healthcare professional. Nurse Martinez, Dr. Miller, Discharge Coordinator Johnson, and Pharmacist Anderson.
Dr. Miller, this is Francisco. Mrs. Hart doesn't feel that she's able to handle the complicated IV regimen by herself. Is there any way that we can make it a little bit simpler for her?
Francisco, I am in the middle of a medical exam. Can you talk to the discharge coordinator to arrange home health nursing care if Mrs. Hart can't manage it herself?
Okay, I'm so sorry to bother you. I will call her right now. I was just going to call you. Mr. Hart is being released this morning, but his wife doesn't feel comfortable administering the IV antibiotics by herself. Is there any way that we can coordinate some kind of home health nursing?
He's not qualified for home health nursing. His insurance won't pay for it, period.
What am I going to do?
A lot of patients are discharged with IV antibiotics to administer from their home. It doesn't usually seem to be too much trouble, even for patients in their late 50s.
Well, it's a pretty complicated 2-week course. Mrs. Hart says that she has depression and insomnia, and I feel like with the dosing schedule, she won't get any sleep.
I agree, it is kind of a rough dosing schedule. I wonder if Dr. Miller could adjust the antibiotics or the dosing schedule?
I don't want to bother her again. She's been in kind of a bad mood ever since she got off the phone with Mr. Hart's dentist this morning.
I'm sorry to hear that. I had to go talk to some patients and their families. Good luck.
What am I going to do? Oh, I'll run it by the pharmacist.
Hi, Francisco. How's it going?
It's just one of those days you want to run and hide.
What happened?
Mr. Hart is being released today with 2 different antibiotics, but his wife can't handle the IV administration by herself. They don't qualify for home nursing, and Dr. Miller wants me to discharge him now so I can get the room ready for another patient.
Well, let me take a look at his chart. Depending on his blood culture result, there might be an alternative treatment. Good. Looks like there are 2 options for Mr. Hart, based on his blood culture results. One is gentamicin. The other is he can switch to ceftriaxone. Both require less frequent dosing than his current regimen.
Good job, Rick. Would you mind talking to Dr. Miller?
Well, I think I should talk to Mr. and Mrs. Hart first, and then I'll get approval from Dr. Miller.
Thank you so much for doing this.
Now for our forum discussion. In the previous video clip, which style was used by Dr. Miller? How did Dr. Miller's style shift under stress? Do you think that each professional used the appropriate style for the presenting situation? What is your own natural conflict style? In summary, there are 5 learning principles that support your understanding of conflict response styles. There are 5 response styles. Each balances the focus on one person's agenda versus focus of the relationship with other person. Each style comes with strengths and weaknesses. Be aware of your own conflict style preferences. This is developed early on. However, if we use the style automatically every time in nearly all conflicts without self-awareness or without the more appropriate response, we set ourselves up for difficulty. Develop style flexibility so that you can choose the appropriate response based on the situation. Develop self-awareness of own response style through practice and through asking for feedback. Be aware of your response style's storm shift, as that may occur when conflict heats up and you're getting frustrated. This shift can be quite sudden and thus surprise, shock, or hurt others. Be aware of the triggers that send you into a storm shift. Utilize strategies to support others to be at their best. Each style has certain requirements that other people can help to meet if they choose that lower stress and anxiety and improve performance. Often, these are simple things that others can do without sacrificing their own goals. Your knowledge of different styles responding to conflict and the skills of flexing your style will promote your ability to handle conflict in a proactive and productive manner for you and the other persons involved.